So recently I came across this New York Times article titled "Therapy is Good, These Therapists Are Bad." And I thought we could have a really interesting discussion about its contents given my experience as a former therapist. Although I was trained as a doctor of clinical psychology, since I decided to pursue being a fiction author and content creation full-time over being a therapist, I feel like I can provide some insight into what might be going on with some of these therapists in the article while also being just a little bit emotionally distanced from the topic since I'm no longer a therapist myself. So let's talk about bad therapists. I'm super excited to announce that my second novel, A Song at Dead Man's Cove, is now available to order. If you love lush, atmospheric, haunting gothic horror, then this is definitely the book for you. It's set in coastal Washington and it has two timelines, one in the modern times, one in the Victorian era. The novel follows two protagonists, one who fears intimacy and one who thinks stealing love will make her whole. So if this sounds like it's up your alley, follow the link in my description box to place your order. Ebook, paperback, and hardcover are all available formats at this time. Thank you so much and stay spooky. Okay, so the article begins with a few one-liner anecdotes about bad therapists. One client who felt the therapist was doing all the talking, another experienced her therapist sharing a maraca in her face to pick up the energy she was giving off in session, which, I'll be honest, I don't even know what that means. One client received thousands of texts from her therapist and eventually ones that revealed her therapist's sexual feelings for her. And the article qualifies that some of these are ethical violations, some are just unprofessional behavior, and others are just bizarre moments. Eric Jones, a California therapist, mentions that established therapists are meant to gatekeep bad ones. And this is absolutely true. But unfortunately, sometimes the people who are supposed to be the gatekeepers, for whatever reason, choose not to do their job. For example, I know someone who, when I was in grad school to become a therapist, stole another student's credit card information from his dresser and bought thousands of dollars worth of items with it. And she did this not once, not twice, but even months after admitting to it in writing and apologizing for it. And the school was made aware of the situation and chose not to investigate it. She graduated a few months later, and she's now licensed as a therapist. And I'm sincerely concerned about the clients of this person whose credit card information she has access to. But unfortunately, since the people who were supposed to gatekeep her did not do their job, that is now a risk that people are taking. And I suppose I'll never know exactly why. What I do know for sure is that gatekeeping is a very important responsibility. Gatekeeping gets a bad rep, but it often serves a crucial function, especially in professions where there are vulnerable populations who must be protected. The article then goes on to discuss boundary violations among therapists. And this is one of those things that's just an automatic no-go, extremely unethical for a therapist to try to have any sort of romantic or sexual relationship with a client. It's probably the most unethical thing that a therapist could ever do, and let me explain why. The therapist-client relationship is one-directional in the sense that it exists only to emotionally serve the client. For example, let's say that there's a client who would benefit from hearing that their therapist also used to struggle with an eating disorder, either because they feel their eating disorder is something to be ashamed about, or because they're wondering if their therapist can understand their struggles. Then that type of self-disclosure is appropriate. Whereas if a therapist is going on and on about their own previous eating disorder, using therapy time to talk about things that don't directly serve the client, that is inappropriate. For example, I was once off-put in high school when I was talking about my eating disorder with my therapist, and she just went on this random tangent about how she once went on a really strict diet when she was in college and she lost a lot of weight. It wasn't therapeutically helpful. I wasn't wondering if she'd had an eating disorder. It didn't really make a difference to me, to be honest, and it just kind of felt in the moment like she wanted a reason to bring it up or for me to feel like she could empathize with my situation, when really by the sounds of it, her situation was different from mine. I had a full-blown eating disorder and she was talking about disordered eating. I don't know, it just left a sour taste in my mouth, and I remember thinking that she wasn't very skilled because she didn't self-disclose in a way that was really in the benefit of the client. So you can imagine how the idea of a therapist getting some sort of emotional or sexual payout from their client is completely out of line. This is not a two-way street. Obviously, a therapeutic relationship is a relationship, and any relationship requires some semblance of respect or kindness that goes in both directions. But it is probably the only relationship in existence where one person is focusing 100% on the other person's well-being with no expectation of reciprocation, right? No other relationship in your life, no friend, no family member, no grocery store cashier is providing you a service where they are focusing on your well-being 100%, and you don't need to think about their well-being at all. It's the kind of relationship where you don't need to check in with how the other person's doing. You don't need to make sure you're also taking care of their emotions. They're responsible for that, and during this therapy time, they are focused 100% on what you need. There's also a power imbalance that can come up in such one-sided relationships. One person is the one being treated and the other one is seen as the expert. And society places a lot of value on credentials and qualifications, which can make clients feel coerced into certain decisions that they otherwise wouldn't make, or make them feel like, I want to say no to my therapist in this moment, but I don't want to rub them the wrong way because they're a therapist and that's a position of power. One party, the therapist, also knows the other party's extremely intimate, vulnerable details about their life, while the other knows very little about the other person. And this is normal if boundaries are intact, but if they're not, that vulnerability can be weaponized against the therapy client. In a normal, healthy, romantic or sexual relationship, both parties are on equal emotional footing. But with a therapist, you have one person who knows a lot more about the other person's psychology than they know about them. And not to mention, it puts at risk any progress that was made in treatment. Because think about it, let's say you lose respect for your therapist because of something they do if you're personally involved with them. Then it makes you wonder, was any of what we worked on actually good work? Could I actually trust you? Could I actually trust your clinical judgment, given that clearly you don't seem to have good judgment in other areas of your life? And secondly, a therapist is supposed to have a modicum of neutrality by nature of not being personally involved with that person's life. All they're supposed to know about the client is what has been revealed in the therapy room, right? They're not supposed to go looking for more information in their personal life. So if, for instance, a therapist becomes friends or involved with one of their clients and meets the client's mom, develops a personal bias for whatever reason and starts to think, no, your mom's actually not as bad as you made it seem, that's obviously going to be really harmful to whatever work was done in the therapeutic relationship. Then the article goes on to discuss unprofessional behavior, not necessarily unethical, but just unprofessional. And here's where I think I can provide a little bit of insight into what this article is missing. The article describes professional infractions such as being chronically late, eating during session, failing to inform clients of fees, missing appointments, ghosting, and falling asleep during therapy. And some of these I agree are a problem, but others I think are a lot more nuanced than that. Failing to inform clients of what fees they can expect, chronically missing appointments, ghosting, I completely agree are not things that should be happening. That is deeply detrimental to the client. But what about being chronically late? So I get it. I'm a very punctual person, and I get really anxious when other people are late, and I myself have had therapists who were late every single time we met. And we're talking like 10 minutes at a time, sometimes closer to 15. The therapist I'm thinking of would also try to end session a couple minutes early every time, which meant that the most times we met, we ended up only meeting for about 33 to 34 minutes instead of the standard 45 to 50 minutes. So that, I think, is very different from a therapist chronically being a couple minutes late and then making up for it, or a therapist on a couple of occasions because of random factors that happened being later than that. Like my current therapist, she's usually a few minutes late to session, but I don't mind it because she's fully present for the amount of time that I'm paying for. And I understand shit comes up in life. I think sometimes clients forget that therapists are human too. They might get 10 minutes in between clients to run to the bathroom, get a glass of water, type up their therapy notes. In cases of teletherapy, sometimes there are technological issues, or their dog might have just thrown up on the carpet. They might need to answer an important call about someone who's in the ER. You never know what someone's going through, and a little grace goes a long way. But regardless, if you're having intense feelings about your therapist's punctuality, that's something you should bring up to them. And it might bring up really interesting discussions about the way in which you feel like other people in your life aren't showing up, for instance. Because although it's a very one-sided relationship in some ways, it is still a relationship. And if your needs aren't being met, or your therapist's behavior produces an emotional reaction for you, that is gold to examine in therapy itself. And how your therapist responds to that is what determines whether they're a good therapist or not. A good therapist will make you feel heard and process through these things every time. They might connect this moment to other patterns in your life, like maybe you often felt abandoned as a child, so being late triggers your fear of abandonment, or maybe you can be a little bit rigid with people, and so you don't allow room for imperfection when your therapist is 2 minutes late on one occasion. These are all things that are really important to talk through and work through. So when you have an issue or you feel like your therapist has dropped the ball in some way or been unprofessional, I strongly urge you to bring it up to them. That'll give you really valuable information about yourself and about them. Like I said, the article also listed eating during session as one of these unprofessional therapist behaviors, and this one I gotta say, I really don't understand why it's unprofessional, because often therapists are booked back to back to back and they don't have time to snack in between sessions. You don't know what kinds of medical conditions they might have. And I feel like you can be fully present with someone even while you are snacking on something. For example, I on one occasion had a nutritionist who was snacking in front of me, which I'm pretty sure she was doing intentionally as a form of exposure therapy since I was there for an eating disorder. So there are a lot of situations where the client might just not be aware why a therapist is doing something. And again, a little bit of grace and a little bit of remembering that this person is a human being and there might actually be a reason they're doing it that goes beyond whatever assumptions you're putting on them goes a long way. What about falling asleep during therapy? This is a tricky one because obviously a therapist cannot help you if they're asleep and you're not receiving the service you're paying for. But again, I think we have to remember that therapists are human beings, and falling asleep in session is not a choice in most cases. If a therapist is falling asleep in session, it's either because they have some sort of medical problem like narcolepsy or because they're completely exhausted. And while their personal issues should not be causing issues for you in the therapeutic relationship, if you have a long-term relationship with this person, there are going to be times when sometimes that happens. And this is indeed one of those areas where being frank with your therapist about their behavior could be really crucial. They might reveal that they actually do have a medical issue and they feel mortified about the fact that it affected you and that them falling asleep had nothing to do with feeling bored by what you were sharing. Or they might reveal that actually they're way too burnt out to be a competent therapist. Maybe the agency they're working for is making them see 40 clients a week, for example. Or maybe they don't handle the rupture very well. Maybe they're just kind of dismissive when you bring it up. That too can bring you really valuable information about how this probably is not the therapist for you. But at least give them a chance to clarify that before giving them the boot, because again, it could be a misunderstanding. I think that sometimes therapy clients make assumptions about therapists, and when they don't communicate their concerns with therapists head on, it can prevent using those moments as a tool for repair. You're going to experience moments of rupture with a long-term therapist. There will be times when you feel disappointed in them, or they let you down in some way, or you have an awkward moment of conflict, or you feel like a session isn't as helpful as previous sessions. That is normal. That is inevitable. And in fact, that is good in therapy, because a good therapist will know how to use those moments to deepen the relationship when you bring it up and to connect the dots with patterns you have in your other relationships. And then there's another story that the article goes into, which is Erin, 30, who lives in New York City, said that she was surprised when her therapist instructed her to watch lights dart across a narrow tube. It's a type of stimulation used during eye movement desensitization and reprocessing therapy, or EMDR. A treatment that aims to ease the distress surrounding traumatic memories. But Erin was in therapy for pandemic-related anxiety, not trauma. Repeatedly, the therapist asked, "Is it working?" Erin recalled, all while their Zoom connection kept cutting out. Wow, this one was cringe to read. I feel like that was probably a very embarrassing session, because I think the therapist's lack of skill is really palpable in this situation. It's really coming through the screen as I'm reading this article. First of all, the therapist should have explained what EMDR is, and not just in a couple of minutes, but very in-depth. If I were to start EMDR with my therapist, we would probably take like a whole session just talking about it before diving into it. The therapist should have first also determined whether it was appropriate treatment for this client and their presenting concern. They should have received informed consent for this treatment modality before throwing it onto the client. And they should have had mastery over the treatment before trying it out on the client like a guinea pig or something. It honestly just sounds like they learned a very surface level understanding of EMDR and thought, let me give this a go, which is not how things like EMDR are supposed to work. There are some interventions that are a lot less structured that you can kind of like learn one week and, start trying out with clients, but EMDR is not one of them. It's a very specific treatment modality that requires a lot of training before you actually start doing it. The article then touches on therapists who can't be bothered. One therapist dismissed a client's fear of dogs when she had her dog in the room. Another therapist just stared out the window the whole session, not even making eye contact with the client. And this type of unprofessional behavior, I think, is particularly difficult to experience within the context of a therapeutic relationship because you're literally paying someone to care for you and to show you empathy. While I've never experienced something like this in therapy, I have had experiences with physicians who made me feel unheard, who seemed in a rush to get out, who didn't thoroughly investigate what I was coming in for, and then it later backfired. For example, when I was in college, I had a contact lens break in my eye. It was very painful. I could tell that there was still a piece of contact lens stuck somewhere under my eyelid. And I went for an appointment at the ophthalmologist. Not only did he dismiss it, he actually said, no, if that were true, you'd be in a lot of pain. I was like, you haven't asked me how much pain I'm in. You don't know my pain tolerance. I am in a lot of pain. It may not look like it, but I am. He also made a really snarky comment while looking in my eye and said, no, don't see a contact lens, but I do see bits of mascara in there, which made me feel really judged as the patient, made me feel like I was, doing something wrong for wearing makeup and like I was just wasting his time for coming in with this jabbing eye pain. And about a week later, I was in the car and I was, digging through my eyelid at the stoplight and I found the piece of contact lens. And it turns out that could have gone really wrong. It could have gotten infected. It could have become a very acute problem because he did not thoroughly investigate it, because he did not believe me that I had a piece of contact lens stuck in my eye because of the way I looked, I guess. And that's the risk when a medical provider doesn't care about their client. It puts them at greater risk of malpractice. You cannot be a good doctor or a good therapist if you do not care about your patients. So the article wraps up by saying that if you feel disappointed in your therapist, there might be situations in which you want to address that with them, which is very similar to what I was saying as well. And also similar to what I was saying, that it's really important to pay attention to the therapist's reaction. At the end of the day, how the therapist reacts to you bringing up a rupture is so much more important than what actually caused the rupture itself. My overall thoughts on this article is that, there are certain ethical violations that should be immediately reported and are unacceptable that every therapy client should know about, like boundary violations, like, trying to have a romantic or sexual relationship with the client. And this is where it's really important for the gatekeepers of therapists to do a good job, because otherwise future clients will get hurt if things get lost in the process. Other issues that clients have with therapists might be a lot more nuanced, and bringing them up to the therapist is probably a good idea to work through the rupture and to gain clarity on whether, for example, you're making an assumption about the therapist or there's some kind of miscommunication. Clients should remember that therapists are also human, and when that comes through, it's not always an ethical violation. When you have a long-term relationship with someone, at some point they're going to be human and make mistakes. What's also really important to remember is that there are bad apples in any batch. And yes, there are lots of bad therapists out there because there are lots of therapists out there. So you have, a huge quantity of people. Some percentage of that is going to end up not being a good therapist. In my experience, the ethical, competent therapists far outweigh the unethical, incompetent ones. With that being said, it does take a lot of trial and error to finally find a therapist that's the right fit for you. I think I went through 6 therapists before finding my current one who's the perfect match. Just be careful because it's really dangerous to fall into a type of black and white thinking where if you have a couple of bad experiences with therapists, you assume that no therapist can be trusted because of it. I've had bad therapists, I've had bad physicians, I've experienced medical gaslighting probably more often than I should have. But I'm not going to sit here and direct my anger towards those individuals onto the entire group that they belong to, because that is not productive and it's not accurate. So just going to leave you with that last sentiment. Let me know what you thought about this article and all of the personal anecdotes that I shared in this video. I'd be really curious also if you've experienced any bad therapists in your life or bad medical providers more broadly. So pop those in the comments down below and I'll see you soon. Tell me what you mean.